and welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the broadcast portion of our show, so let's just get started. We had one question about cataracts and chronic vertigo. Do you ever see a combination of vertigo associated with cataract surgery?
No. So vertigo we think of more as a middle ear, an inner ear problem. Yep. And so usually people will think their eyes are the cause, but oftentimes they're kind of two separate issues.
Yeah. I would say that people who have lightheadedness, not vertigo, oftentimes have too much blood pressure medicine, or blood flow to the brain is not quite right, and you worry about vascular flow. So be careful and have a general primary care doctor check you over on that. Restasis. Vance, dry eyes. I've got special glasses. I use Restasis, but it's not perfect. What is Restasis?
Well, Restasis is cyclosporin, so it's a very effective anti-inflammatory. And we can use steroid eye drops when someone has real inflamed eyes, but with time, steroids can cause other things like glaucoma and cataracts. And so the nice thing about Restasis is it's an anti-inflammatory that doesn't cause those things, but sometimes it can cause stinging and burning in about 17% of patients. But there's other things you can do besides those glasses. We can put in punctal plugs, where we can plug the drain that takes the tear away. And if you can get your own tears to stay on your eyes longer, plugs are great. Turning off the ceiling fan, or increasing the home humidity.
Or looking at the medicines you're taking.
Right. And so there's a bunch of things you can do for dry eye. And the oily layer that we call the meibomian layer is made by glands in the eyelids. And we can image those glands, and you can actually heat and express them and get those to flow better. A good exam is what you need for a comprehensive dry eye plan.
Right. It's not an easy question, is it?
Right.
I'm going to blame the pills, though. Too many people take too many pills. The worst culprit for dry eyes and dry mouth are the pills that people use for their bladder. So, and they don't work very well anyway. I've stopped prescribing them. People will ask for them, and I said, you decide. The antihistamines and the decongestants commonly will dry the eyes out and the mouth. There are blood pressure medicines that will cause it. The diuretics will cause it. You just got to talk to your primary care doctor as well as your ophthalmologist. We have a question. A Vermilion Man asks, what causes eyes to drain continuously? So now we've got a watery eye situation, not a dry eye. Yeah. Mike, what is that?
So there are two causes of having too many tears. One is, so we're always making tears in our eyes, and they're draining out through that duct that we've been talking about plugging. So either we're making too many tears and it's overwhelming the system, or we're not draining enough away. So it's a case of filling the swimming pool with a little water, so a little bit should be coming out constantly, or else it overflows. So the first thing I check is that drainage duct open? So we can do that right in the office, flush a little bit of water down it. It should come out into your nose, actually. That's why when we cry, we all have to blow our nose afterward. All those tears are running into the nose.
That's interesting.
So we want to make sure that we're draining them away properly first. And if they're draining properly, the next step, or next cause is we're overproducing. And so we want to look into why they're overproducing. The most common culprit is actually dry eyes. So the eyes get a little dry. It turns on the gland that says we need more water. Water comes. But we really need oil also, and we talked earlier about
meibomian glands.
Meibomian glands and the goblet cells of the eye. But water itself is not a good lubricant. It actually washes away oils. So we kind of have to try to stop that feedback mechanism where the eye gets dry and it says produce a lot of tears and it just keeps going round and round. Yeah. So we have to treat the underlying cause in that situation.
It's really interesting. Dry eyes causes watery eyes.
Yeah.
That's amazing. A Yankton man asks, 2 years ago, cataract surgery vision isn't quite as clear as right after the surgery. I was told would probably need a follow-up surgery. Is this follow-up surgery a one-time fix, or would it need to be continually done?
Well, the cataract sits in a capsule that's as thin as saran wrap. It's almost like a grape skin. We take off the front of the capsule, remove the cataract, put the implant in, and over time the back capsule can get cloudy. And that's what we laser. It's called a YAG laser, and so you should see your doctor to consider that.
How about people who wear contact lenses and get dry eyes?
So when you have a contact lens on your eye, it's a foreign body. It doesn't matter if it's the newest contact lens or the oldest one, it's a foreign body on your eye, and that's going to cause some irritation. It can cause inflammation, and we know inflammation causes dryness, irritation. So a lot of people with contact lenses will say, sometimes they'll seek out Lasik surgery as a result because their eyes have become too dry to tolerate their contacts anymore.
But that's a problem with Lasik surgery, isn't it? Because dry eyes.
I'll let Dr. Thompson speak to that, but yeah.
It's one of the reasons that I'm experienced at treating dry eyes is what we do is we can treat them beforehand and be able to diagnose whether or not they can have Lasik. And so it's a very important test before a contact lens or a Lasik evaluation. And a part of any of our evaluations is to look at the tear film and treat it to a point of being able to enjoy a contact or a Lasik.
Okay. We had a question about contact lenses reducing vertigo. Mike, do you have any answer to that? I don't.
I don't have any
good ideas.
Background with
Vance?
contact lens and vertigo.
I don't either. Sometimes with monovision, people can feel like they're having a hard time with the reading eye, distance eye combination, and it can accentuate things like that. But no, I think you need to see your general eye doctor when you have vertigo issues and check your inner ear and all those types of things too.
Now I know that in both your offices you have ophthalmologists who are MDs and optometrists. Could you explain the difference?
Well, training is the big difference. Obviously, ophthalmologists like Dr. Thompson and I go to medical school.
Went to medical school like I did, 4 years of medical school.
Correct, 4 years of medical school, and then we did a residency in ophthalmology, and we're trained in not only eye conditions, but also eye surgery. Optometry is a separate school, so you don't go to medical school first, you go there from undergrad, you apply. So it's a graduate program, it's 4 years and very intense with learning eye conditions, diseases, some of the treatments for that, but there's no surgery component to it. So those are kind of the difference between the two tracks.
Okay.
And very complementary disciplines. I think one of the reasons both our offices do that is it works really well.
Right.
You know, they work very well together, and it's amazing. I mean, especially in rural South Dakota, there's a lot of optometrists all over our state, and so ophthalmology and optometry work really closely together.
Yeah. How do you know which one to see? I mean, I suppose when you can start with an optometrist, and a good one will say, there's the time that you need to see the ophthalmologist?
Exactly.
Okay. A Sioux Center woman asks, I have dry eyes and use drops, but I'm also on Lasik. Could this be causing the dry eyes? And the answer is yes, but I'm not about to suggest stopping the Lasik. I'm a Lasik prescriber, boy, and you know, probably my most prescribed medication in my whole lifetime. So you've got to be careful. Talk to your doctor. Tell her or him that you have dry eyes.
Don't stop your medication trying to fix your dry eyes.
Do not stop your medication, but talk to your primary care about it. And
we have some similarities. I do Lasik, and you prescribe Lasik.
Yeah, there we go. So, we're just brothers in medicine. That's it. A Rapid City woman says, I just had cataract surgery yesterday. How long after surgery will I have to wear glasses? I also have MS. So,
so is cataract surgery yesterday?
Just had cataract surgery yesterday. How long after surgery will I have to wear glasses?
So when we do cataract surgery, a new lens is put into the eye, and that changes the prescription. So oftentimes I'll tell people your glasses might be entirely wrong for you.
Yes.
So usually the question we get is, what do I do now that I've had surgery and one eye wants the glasses and one eye doesn't? And the answer is a little different for everybody. Some people will pop a lens out of the glasses so that one eye can have the right prescription still, while the other one is waiting for its new prescription. We
or put a clear lens.
Clear lens in.
Or
just not wear the glasses. But there's a lot of options, but everybody's a little different.
Okay. One viewer says, I have Stargardt disease, which I have been told is similar to macular degeneration. What is the difference between the two?
Well, Stargardt's an inherited disease, and so it's going to affect a much younger population. But and we'd have to get our retina colleagues to get the real.
But it has to do with the retina.
Yeah,
and it's an inherited thing in a younger person.
Yeah.
Okay. I have Stargardt.
Stargardt's is how it's.
Stargardt's.
Yeah.
Okay. I forgot to. Do people with MS, because the Rapid City woman who had called had that cataract surgery yesterday, Do they have a lot of problems with vision?
Yeah, they can get optic nerve problems, and they can have it affect their vision. It's
mostly all divergent, isn't it?
Yep, and they have all levels of severity. We see a lot of MS patients that do very well with their vision, and some have more challenges, and that's why you want to have a good neurologist who's helping take care of you, and your general practitioner and your eye person.
Yes.
Yep.
An Aberdeen woman says, my sister had cataract surgery. A few months afterwards, she developed some type of covering on her eye, similar to cataract, which had to be lasered off. Is this a common occurrence, or was that a rare thing? That's that YAG surgery.
Yep. That's a very common occurrence. I usually quote 1 in 3. I don't know what number you give.
Yep.
So very common. The good news is very easy to fix, and usually it's a permanent fix once we've lasered that off.
I've had 2 YAGs. A T-man says, macular degeneration, never heard of it in the 50s. In the 60s, is this a newer disease, and is it hereditary? Vance?
Well, it's not
new disease.
New. You know, it's been here since the beginning of time, and it can have some inherited tendencies. And but it's one of those things that doesn't mean if your parents had it, you're going to for sure get it. But it is a good reason to have a good eye exam and have it monitored, and have, you know, preventative therapy if it's prescribed by your doctor. But I wouldn't be self-medicating or diagnosing this type of thing.
I like the idea of lifestyle changes that you would do to prevent heart attack and stroke. You know,
right.
All those good things of a regular, did I say it yet? A regular walk every day. You know, if you walk 1 mile a day, you get the biggest bang for your buck on an exercise program. Totally agree with you guys?
I totally agree.
Yep. All right, a viewer asks, how does ocular rosacea affect the eye?
So rosacea is obviously the inflammation kind of pattern along the nose and cheeks there, but it can get up into the eyelid and cause what we call blepharitis, which is inflammation of the eyelids. And when that happens, the oil glands aren't very healthy, and they're secreting this poor quality oil onto the eye, which is irritating, it burns, it can make the eyes red. Often some of the same problems we have with dryness, because it goes along the same spectrum. The treatment for it, though, in ocular rosacea, is to actually treat it like it's ocular rosacea. So usually we put them on an antibiotic pill and try to calm everything down that way.
Doxycycline generally is what or tetracycline, or it used to be cheap. Now it's expensive. Why did that happen, I wonder? Darn pharmaceutical
it's
people.
Frustrating, isn't it?
We have a question about lipid-slow treatment.
Lipoflow.
Lipid flow.
Yeah.
Treatment for dry eyes.
Well, the glands that can get clogged in the eyelid, ideally they would flow, and it almost looks like olive oil, and it just beautifully coats the surface and protects our tear film. But they can almost become like Crisco that is whitish, and you can warm it, and you can try to get it to be more flowable. And then we used to have patients massage, but we also tell people not to rub their eyes. And so massaging is, you know, something that has been kind of solved by LipiFlow, where behind the eyelid, you know, between your eye and eyelid, you can put a little barrier that will warm on your eyelid, but also you can compress just the eyelid and not push against the eyeball.
And get that
so LipiFlow can
oil
get
glands
these
flowing.
oil glands flowing.
The meibomian
but you also
glands.
can diagnose the problem with LipiView, which is its testing little brother that will show you a picture, kind of an infrared picture of, are those glands clogged, and how are they healthy or not?
Now, in the old days, we used to treat that, all of those blepharitis or all of those conjunctival, or the infection along the eyelid, and the that we talked about earlier. I'm blocking on the word.
Rosacea.
Rosacea. Yeah, the rosacea thing. By warm, just warm towels and just let it lay there for a while and let it warm up, and then you cleanse it gently and use baby shampoo, except the baby shampoo might be harmful in taking away the oil?
Well, ideally you're not taking away the good oil, you're taking away the bad oils. So I do, there's a lot of different tea tree oils that people are using for this now with Demodex and things in the lids.
yeah.
But I'll still use some baby shampoo because it is a gentle soap if you get a little in your eye. But yeah, you don't, ideally you aren't taking away from the surface of your eye, you aren't taking away the good oils, you're removing those bad ones.
Yeah. Well, you know, and they're all part of our normal flora, so you want to be gentle.
Upset that balance.
Right.
One woman says, I have macular degeneration. I did lose my central vision in 2000. Now I have a cataract in the left eye. Would it make sense to have it removed since I don't have central vision? What would you do? Well,
you know, again, a good examination. A mild cataract, sometimes cataract surgery won't help if there's macular degeneration, but eventually, typically it gets dark enough that it can be very helpful. And so a good eye exam will answer that question. And cataract can make your vision better, cataract surgery.
I have some very happy patients who have 2400 vision afterward because of their macular degeneration. But they say, I can see the car beside me now because my side vision's restored.
Right.
I had a patient, she was a smoker, and she lived to be into her 90s. But she had terrible macular degeneration, and she would come into my office and she'd look to my side and say, "Hi, Dr. Holm," and it's like, who are you looking at? And of course, it was
she was using her side vision.
She was losing her peripherals, as the 40-year-old virgin movie would talk about. Sioux Falls man asks, I have a Prism in my glasses to correct double vision. Is it possible to have this corrected by Lasik?
No. Typically that's because the eyes aren't aligning perfectly, and it's either Prism or eye muscle surgery to align the eyes.
Okay. A Madison man asks, I have macular degeneration, get shots in the eye for that. Gastroenterologists are putting me on steroid shots. Are these two shots going to affect each other?
Shouldn't be any effect between steroids and the macular degeneration shots.
Okay. He's in trouble though. He's got another problem, doesn't he? One viewer says, I had cataract surgery about 3 years ago. I've been having fuzziness in my vision recently. My regular eye doctor said there may be a procedure to buff it out. What exactly do you do to help make the vision clear again with buffering?
That'd be the YAG laser again to treat that capsule behind the implant. Very common.
An Aberdeen woman says, when I close my eyes, I see stars around edges, especially at night. What causes this?
When we kind of take away all the stimulation to our eyes, it'll make up its own sometimes. And so usually when people tell me they do it at night, they only see it in a very dark room or they close their eyes. It's just a phosphine, fancy word for kind of a bright light being caused by those neurotransmitters back there being stimulated in some way but not really knowing what to do with it.
Right. So it's our brain messing around with us, and it's not a dangerous thing.
Very normal.
Can you talk about ocular migraines? I can see colors in places where colors shouldn't be when I've had a headache. Any suggestion for that? Well, this person has migraine, not ocular migraine. There's a difference, right, Vance?
Right. Yep. So ocular migraine is usually affecting just the eye, whereas a classic migraine is affecting the blood flow to the brain. And so they're different, and the ocular migraine typically isn't followed by headache, where is the other migraine can have headache be a big cause.
And these visual things that can be all sorts of things. One woman asked, can eye makeup cause any troubles to the eye?
It causes irritation, allergies, dryness, just like any other foreign body that shouldn't be in the eye getting in there. And we see that a lot when you're doing eye exam. You look at the tear film and you see mascara floating in it, and you say, well, I think I know why your eyes are irritated. And boy, it's a hard thing to change for some people, though.
Right.
Right. Eyelash growth serum. Ever heard of such a thing? What's that?
So one of the side effects of a glaucoma medicine was that eyelashes grew longer and darker. I think that's what you're talking about. So they rebranded it, called it Latisse. Brooks Shields started selling it, and it was so it's very safe for the eye. We've been putting it in the eyes for years as a glaucoma drop, but it basically comes with a brush and you apply it to the lashes, but they do grow longer. Some of these people who've been on this glaucoma drop for years, you know it.
Right.
You look at it, you're doing their cataract surgery, and you go, oh my goodness, you must be on glaucoma drops because you have such beautiful long lashes.
Right.
So it's not a bad thing. It's just a side effect of a glaucoma drop.
Wow, I didn't know that.
Right.
I thought I knew everything. Never heard that.
Something.
A Madison woman asked, my son works on a computer a lot. Are there any exercises that can be done to help with the strain of looking at the screen, Vance?
I think taking breaks. is important. Thinking about the distance, you know, the closer you get, the more strain it's going to be. You know, thinking about the workplace, how is the humidity? Is there a fan blowing right on you? It can dry your tear film. But just taking breaks and looking at a distance and relaxing them, and it's not going to cause permanent damage, but it can sure help your workplace productivity and joy.
Do you recommend special computer glasses for some people because they have this vision?
Well, you know, there are filters that can help filter out some of the blue light, for instance, that sometimes is associated with fatigue. But also, if people's eyes aren't coming together properly, sometimes, even though it's not causing double vision, it can cause eye strain. And a little bit of Prism that your eye doctor can show you can bring more comfort at the computer.
And I saw that you were nodding. You prescribe those?
So, yeah, so glasses, I have multiple patients who are in a different pair of glasses for the computer than they are for their everyday world, because it's at a different distance than most of the things we're doing. And therefore we need different power. And as Vance was saying, that little trick of using some Prism, because when we look at something at near, our eyes turn in. When we look far away, they go out. So if your muscle isn't quite strong enough, you're working all the time to look at that book or computer, whatever it may be, and if you give a little Prism, it kind of takes away that need to turn in by themselves.
Wow. I might just get some help on that. I'm on that daggone computer too much. A Worthington, Minnesota woman asks, I had my eyes checked and they found bleeding behind my eye. Now I get shots in my eye, probably wet macular degeneration or diabetes. Now I get shots in my eye. How much do you think this will improve, and how many shots does the average person get?
You know, I'm not a retina specialist, and I'm not sure, but I do feel that should be under the direction of a good quality retina specialist, and I think it's a long-term treatment.
Yeah.
It's highly variable. Like Dr. Thompson said, it depends on if it is diabetes or if it's macular degeneration, and even retina specialists are struggling with the question of how long do we inject. Right now, what the majority of them are doing are what they call inject and extend. So they give you some today and they see you back in 8 weeks. Well, it bled before then, so they say, well, we'll give you an injection today, we're going to see you in 6 weeks. And then, okay, that's better, and we'll go back to 8, and we'll go to 10 to 12. And so some people are stretched out to 6 months on these shots, where others have to have them every 4 weeks.
Okay. Wow. And the last question. The old Karnak.
Yeah.
A Lake Wilson man asks, my mother had macular degeneration. Do I have a chance of inheriting that? And the answer is
yes.
Probably.
You have a chance, yes.
Yes. Not a huge risk. Thank you for joining us on our Facebook page. We appreciate all of your questions and the opportunity to answer them. And until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.